Hi everyone, welcome back. I'm Pooja and today we're kicking off our oral radiology series and we're starting out by going over some key fundamentals. Let's get started. Let's start by taking a look at the x-ray machine itself, and the main part we'll focus on is the tube head, and that's where the magic happens and the x-rays are actually produced. So inside the tube head, there are a few key players that make the whole thing work. First up, we've got the cathode, which creates the electrons. Then there's the anode, which takes those electrons and turns them into X-ray photons. And another important component is the filter, and it's usually made up of aluminum, and its job is to filter. And it filters out the longer wavelength photons that aren't useful and would just add unnecessary radiation exposure for our patients. And finally, there's the collimator, and it's typically made up of lead, and its main role is to shape and to limit the size of the X-ray beam. This helps reduce scatter radiation, which results in clearer images for us and more protection for the patient. Now, there are a few key factors that affect how our radiographs turn out. So before we jump into any kind of diagnosis, it's super important to evaluate the image quality first. But before we get into the nitty-gritty, let's clear up two important concepts, and that is density and contrast. So these are terms that are commonly used to describe what we are seeing on our radiographs. So density refers to how dark or light the image is overall, and it's influenced by how intense the X-ray beam was. Contrast, on the other hand, is all about the differences between neighboring areas on the image, and it reflects how much variation there is in the shades, which comes from the X-ray energy. So now here's the catch. Density and contrast don't always go hand in hand. Changing one doesn't necessarily mean the other will change too. So if we take a look at the examples on the right, up top you'll see one image with lower density and then one with higher density. And do you see how the overall opacity shifts? And then down below we've got two images showing high contrast versus low contrast. And do you notice how the details pop differently in each image? And these differences really matter when we're trying to make accurate diagnoses. All right, let's talk about the first big factor that affects our image, and that's exposure time. Basically, the longer the X-rays are hitting the sensor, the darker or more dense the image gets, and too much exposure leads to an overexposed image, which really isn't helpful for our diagnoses. Next up is tube current, and this refers to the amount of electrical current that's flowing through the X-ray tube, and as current goes up, so does the density of the image. It gets darker because more X-rays are being produced. And then we've got tube potential, which is actually measured in kilovolts. And when you increase tube potential, not only does the image get denser, but the contrast actually goes down. So higher voltage means a darker image with less difference between light and dark areas. All three of these work together to shape how our final radiographs look, so understanding them really helps us to optimize our image quality while keeping patient exposure as low as possible. Now let's talk about filtration. The filter's job is to remove low quality photons from the X-ray beam, and these photons don't contribute to the image and they only really add unnecessary radiation to the patient. So when we increase filtration, we reduce both image density and the contrast, so the image becomes lighter and the differences between the structures become less pronounced. If we look at distance, as we increase the distance between the X-ray source and the tooth, the density of the image decreases. That's because the X-ray beam spreads out over more distance, which reduces its intensity by the time it hits the sensor. And finally, we have collimation, and this narrows the size of the X-ray beam, which limits scatter and radiation, and this ultimately results in a better image contrast and lower patient exposure. So even though collimation doesn't really affect density, it plays a key role in improving image quality. When it comes to radiology, it's important to know there are two main types of imaging we can use, film and digital. So with film, the image is created through a chemical development process, kind of like how traditional photos used to be made in a dark room with lots of chemicals. Digital, on the other hand, uses electronic sensors to capture and process the image right on the computer, and each has its own pros. So film tends to give us images with higher contrast and greater contrast resolution, and many people find it easier to position the film receptor during image capture, while digital imaging comes with some big advantages too. It's faster since the image shows up almost instantly. It also gives less radiation exposure for the patient, and it makes storage and sharing a lot easier since there are no physical films to deal with. So while both have their place, digital has definitely become more common in most dental practices today. Now let's take a look at some of the effects of radiation, and dental x-rays in general take on a very low dose of radiation and thus do not have any deterministic effects. This also makes it safe to take dental x-rays during any time of pregnancy and is not a cause for dental caries. Due to the process of taking dental x-rays, you may have patients that come in with severe gag reflex, in which you can ask the patient to breathe through their nose, lift their left leg, and then place the sensor in their mouth when they are distracted to kind of help alleviate that gagging sensation. Now, you may have patients that come in with a history of radiation therapy relating to cancer or other health problems, and in these cases, it's really important to take some precautions and be aware of what they may present with. So asking the patient's physician or oncologist about the area and the extent of radiation used is crucial. Next, we can talk about the patients with a history of radiation therapy or are currently undergoing chemotherapy or radiation therapy. Please know that these x-rays are unrelated to the ones you'll be taking in your dental office, and these patients with head and neck radiation therapy may have xerostomia or dry mouth, osteoradionecrosis, where bone becomes necrotic and exposed, or oral mucositis, which is inflammation of the oral mucosa. For oral mucositis, viscous lidocaine is sometimes used as a topical anesthetic to help manage pain that's associated with oral mucositis. And oral mucositis is a common side effect of chemotherapy, radiation therapy, or other conditions that can cause inflammation and ulceration of the oral mucosa. All right, now let's try some questions. Our first sample question asks, after completing an oral exam, the patient is diagnosed with xerostomia. What is the least cause of the xerostomia? So our patient here is a 50-year-old male. Their chief complaint is, I am here for my oral exam. They have a history of prostate cancer. They received radiation therapy on the site 10 years ago, and the current findings are xerostomia. All right, guys, take a second to pause and to answer the question. All right, let's take a look. The correct answer here is B, radiation. Although radiation therapy can cause xerostomia, it is likely a possibility only when the radiation therapy is in the head and neck region. And since the radiation therapy occurred on the site of the prostate cancer, it is not the reason for the patient's xerostomia, and all the other options are likely possibilities of causing xerostomia. Our next practice question asks, a patient received head and neck radiation therapy and is now in need of dentures after extractions. What is the next best step? All right, guys, take a second to pause and to answer the question. The correct option here is C, consulting the patient's physician about the extent and the area of radiation they received. Options A and B are incorrect because the physician typically wouldn't have a detailed knowledge about the dental prostheses options or the materials. And option D is also incorrect because we shouldn't automatically deny treatment unless there are clear contraindications. It's always best to gather all the relevant information before making that decision. As we come to an end, let's do a quick recap of what we went over in this video. So dental x-rays can be taken at any time during pregnancy. And for patients with a history of radiation therapy, it's important we consult their physician or their oncologist. All right, guys, that's it for today's topic. Thanks for watching, and I'll see you next time.